Well, good afternoon. We have the best and brightest minds driving Ontario's robust COVID-19 testing strategy. We have thousands of laboratory staff, hospital staff, pharmacy workers, all working together, all making great sacrifices to build an extremely robust testing system. Today, we should all be proud of the fact that Ontario has completed over 4 million COVID-19 tests, more tests than all the provinces combined across the entire country. That's 4 million tests delivered through our 150 assessment centers, 77 pharmacies, long-term care homes, pop-up and mobile testing units right across the province. Last Friday, we announced updated measures to help our testing centers prepare for the colder months and build capacity for the second wave. Thanks to those measures, we have eliminated the long lineups. Folks who need it can now get a test by appointment. And this gives people certainty when it comes to testing. By working around the clock, we've also been able to reduce the testing backlog by 40% since last week. We now have 77 pharmacies offering testing, and this number will continue to grow. We're going to continue to invest in testing. We invested an additional $7.7 billion in healthcare during the first wave. We've gone from 4,000 tests in early April to over 40,000 tests a day over the last week. And now we're investing another $1.3 billion for testing and contact tracing through the COVID-19 Fall Preparedness Plan. That's $710 million to expand our lab capacity, reduce backlogs, and build our testing capacity to 50,000 a day and beyond. In fact, we hit a new daily record high for testing yesterday with over 42,000 tests completed. And there's another $360 million to expand capacity in our assessment centers. My friends, this is the largest, most comprehensive COVID-19 testing plan in the entire country. And the new rapid test will be an absolute game changer. We also need everyone to download the COVID Alert app. Over 3 million Canadians have already downloaded it, which is incredible, but we can do better. It's the easiest thing you can do right now to protect yourself and help our frontline heroes. And my friends, we have to thank all the laboratory staff, the nurses, the pharmacists, the doctors, the PSWs, and everyone on the front lines. Everyone who is working around the clock to get us through this. By working together, we will get through this. Thank you, and God bless the people of Ontario. Now I'll pass it to Minister Elliott.
Thank you, Premier, and good afternoon. Ontario has established a strong foundation for testing and case and contact management that allowed us to rapidly identify and contain any outbreaks. When we first started testing back in late March, our province conducted 4,000 tests per day. By working with our partners, we are now well on our way to increase testing capacity to process 50,000 daily tests by mid-October and 68,000 daily by mid-November. And last week, the province hit a new milestone and completed over 4 million COVID-19 tests since the beginning of the pandemic. This is more tests than all of the other provinces combined. Our broad range approach to testing has helped us determine if and where COVID-19 was spreading. What we found was that it wasn't circulating widely in every community. This was an important learning that helped us make the informed decision to target our resources to those experiencing symptoms, to protect the most vulnerable, and support outbreak investigations. We continue to look at ways to provide patients with timely access to testing and results, especially as we enter into the cold and flu season. That's why we are investing $1.3 billion to enhance and expand efforts to test, trace, and isolate new cases of COVID-19 as part of our fall preparedness plan. As part of this funding, $1.07 billion will expand laboratory capacity, reduce testing backlogs, support existing assessment centers, and increase testing locations and capacity. To provide Ontarians with more access to testing and reduce testing wait times, the province expanded testing sites to participating pharmacies, with more to join in the coming weeks. To provide certainty to patients as to when they can receive a test during the cold winter months, many assessment centres across the province have introduced online booking for Ontarians to book appointments faster and at their own convenience. This will complement telephone booking that continues to be available where used. Ontario continues to expand testing options that can be used by a range of healthcare professionals. We are working with the federal government to access the recently approved Abbott ID Now point-of-care test to increase options for testing and support our pandemic response. As the Premier mentioned, we are also continuing to urge our federal partners to distribute these rapid tests as soon as possible. Testing is critical in helping to identify cases and stop the spread as we work to avoid a severe second wave. But again, ultimately, the best way to protect one another is the same advice we've been following since this outbreak began. Maintain physical distancing, wash your hands thoroughly, wear a face covering when you have to go out, and please stay home when you aren't feeling well. We are truly living in unprecedented times, but by following these simple guidelines, we can protect one another and beat COVID-19. Thank you.
Okay, we'll go to the phone line for questions.
Actually, Ivana, before we go to the test, I have to give a shout out to my good pal, Premier Dennis King from PEI. Folks, they sent over, when I called out for help, we had the premiers call me, and Premier King spoke to yesterday, and he said, Doug, we're sending you 2,000 kits, which equals 8,000 tests. Now, this is a province with 157,000 people, helping a province of 14.5 million people. I just want to tell the people from PEI, I absolutely love you folks. And I promise you one thing, when we get through this, I'm going to be out to PEI and thank you, because I also remember at the beginning of this, you sent a whole tractor trailer full of meals to Ontario. And this is what I mean about showing the great Canadian spirit and working together, sticking together. And not only Premier King called, Premier McNeil from Nova Scotia, Premier Fury from Newfoundland, Labrador, and of course, my good pal Blaine Higgs from New Brunswick. You just gotta love these coasters. They're the type of people, you know, in a crisis, you knock on their door without even knowing them. They'd invite you in. You'd be sitting there having dinner with them, and they'd give their shirts off their back. So, Premier King, and to all the folks at PEI, I love you. I will be there, and we're going to have the best Ford Fest barbecue PEI's ever seen when I get out there. And this is just amazing. I'm getting chills talking about this. This is incredible. So thank you so much, and the people from Ontario, thank you as well.
Okay, we'll go to the phone line. First question.
Your first question comes from Graham Richardson with CTV News Ottawa. Please go ahead.
Hi, Graham.
Hi, Premier. Just a quick question. We've seen the Prime Minister, and I'm not sure if you've been asked this, but also Mr. Trump, have you been tested for COVID?
I have. I've been tested, I think, 3 or 4 times. I'd set up appointment. I think it was last week. I don't know if you remember, but there was someone in our circle down here at Queen's Park that tested positive for COVID, and I went and got a test. Okay.
Yesterday you talked about the positive things that were happening in schools. Mm-hmm. We're hearing a lot from our audience about confusion overall about what parents should do. It's okay to go to a club as long as there's 99 people there until midnight or till 11, whatever the rule is, but don't go visit your grandparents. Stay with your family, but you can go out for dinner for as long as there's only 6 people. What do you say to people who are just flat out confused, and they don't know what to do, and they're trying to do the right thing, and they're very, very worried about where Ontario is going, because it feels like things are getting worse and it's not working. We hear that all the time.
Mm-hmm. Well, I'll be very frank. I'm hearing the total opposite. We're flattening the curve. We're putting the protocols in, and I'm just going to compare restaurants to going over and seeing your loved ones. And this is going to be about as clear as I can be for Thanksgiving. You know, what we're asking, try to stay within the family. If you're going over, and I understand there's a lot of single people out there, if they have a family they're close to, please wear a mask, keep social distance. And regarding restaurants, that's like apples and bananas. When you go into a restaurant, they're taking everyone's name. You have 6 at a table. They have dividers. They have protocols in place. And the rest of the people in the restaurant, you don't know. That's the difference. At a family, you know the people. Please, it's very simple. There's rules and there's guidelines. The rules are very clear. 10 indoors, 25 outdoors. I would really, really discourage people from having 25 people, even if it's outdoors. Stick within 10 people. And folks, we went through so much together. We can get through this. This is going to make or break it this Thanksgiving. We see the numbers slowly flattening. They still are high, but I've seen a decline yesterday. The testing is up to 42,000, a record. And I don't know how Matt Anderson does it. I know I've said he's a champion, but he is a champion. He's moving forward with a record number. We're going to increase the numbers, even with the struggles that we've had with getting the lab technicians and getting the reagent. But he's pulled a rabbit out of his hat somehow. The guy's unbelievable. So he's going to continue doing that, and we will get through this. And Thanksgiving is kind of make or break it. Just please hang in there. I have a big family, and I told Carla, I said, and she knows, we have no more than 10, and simple as that. And that's what we're going to obey by as well. And when it comes to having everyone over, your aunts and uncles, hang off on the hugging and the kissing and everything else. I just want to make through it the Thanksgiving here, but we see a little bit of the flattening right now, but we need to bring the numbers down still. So that's about as clear as I can be on that. So there shouldn't be any confusion.
Next question.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, Cynthia.
Hi there, Premier.
Hi. Hi.
I was wondering, I was on the websites for various hospitals today, Premier, and trying to book an appointment at assessment centers. And it's almost impossible to get a booking for an appointment to go and get tested either today or tomorrow and down the line. So what do you say to people who maybe they're not standing outside for 6-8 hours waiting in line, but they still can't get tested easily at this point in time?
Yeah, sure. Good question as usual, Cynthia. Before I pass it to Matt Anderson, we're just asking people, if you don't have symptoms, please don't go there. And I gave the example, those great little hockey players showed up, they're great, but just imagine 2 hockey teams full in uniform showing up for no other reason, but they want to get tested. Or someone's going away, they want to get tested. If you aren't showing symptoms, please. And even in saying all that, even with the lab testing, and by the way, we brought the numbers down by 40%, which is huge over the next few days. So I want to thank the people. And we're still breaking a record. With all this going on, Matt Anderson, we're still breaking a record at 42,000 people, over 4 million tests. I don't know how he does it. It's amazing. So I'm going to call Matt up. Thank you.
Thank you, Premier, and thank you, Cynthia, for the question. And just to clarify, Matt Anderson doesn't do it. It is a whole crew of people all across this province, with particularly our lab team that does it. The Premier calls me and I'm the face of it, but both the Premier know and I know that it's a huge team effort all across this province of amazing people who are working incredibly hard to deliver on those timeframes. With respect to your question, Cynthia, I think what I'll do is maybe back up a little bit and repeat a little bit from our health minister back on Friday as we talked about the shift from walk-in to appointment only moving forward. First off, the key thing here is about safety. And the health minister was very clear on this point. And this is something that she speaks to me about regularly. It's ensuring the safety of everyone and having people who have both symptoms and not symptoms outside as the weather gets worse not a safe environment. And so strong encouragement from our health minister to ensure a safe environment for everyone, particularly when they're going to get tested. In terms of being able to access a test, we'll work with the hospitals. Certainly in Toronto was our biggest shift. Many of the jurisdictions outside of Toronto were already largely or on their way to doing appointment-based testing. So we'll work with our hospitals, and we'll talk a little bit about that for a moment, in that one of the big goals that we have as well, secondary to safety for sure, but a goal nonetheless, is to make sure that we are providing enough testing capacity in the right places. And one of our challenges when we think about the walk-in scenario that we had before is that if a hospital or an assessment center was to increase their testing on that day and we didn't know about it, then you could see a few hundred or maybe even a few thousand more tests going down to a lab, that lab not knowing that those tests were coming, and then having to shift those tests to a different lab. In that kind of model, from a turnaround time perspective, we could lose a day or even 2 days trying to move those tests around. In the model that we have now of appointment-based testing, we can be a lot more deliberate. If there are hospitals and assessment centers out there who are seeing that their wait time for specimen collection is extending out into multiple days, we can work with them to proactively identify how many more spots do we need, and most importantly, when we bring those spots online, where are those tests going to go, so we can actually get the benefit coming out the other side. One other quick comment that I'll make, Cynthia, and sorry for the long answer. Also, one of our goals is to improve turnaround time. So not so much when, the time to get your specimen collected, but more importantly, when are you getting the result? And part of what we're looking at here through a more deliberate approach to testing is our model before, as recently as last week, you would stand in line for, unfortunately, a long period of time. You may or may not get tested at the end of that. You may get a card that says you need to come back. And then when you do, we would have multiple days of turnaround time, sometimes 5, 6, 7 days of turnaround time. Our goal here is to be more deliberate. If you are waiting up front a little bit longer to get the specimen collection, but are we gaining the time on the other side, trying to get that turnaround time down so you're getting that result faster. That's our goal in the back end. Of course, the front end, as our health minister said, is about safety and convenience for people. Thank you.
Follow up?
Thank you. And Premier, my next question is for you. Yesterday, the Associate Medical Officer of Health said she recommended people stick only to their immediate family for Thanksgiving dinner. You just a few minutes ago said stick to the limit of 10 people. That is mixed messaging, is it not? And it's confusing people out there. So which one is it? Because, I live in a small home with under 10, but you're saying I could have 10.
If you play, sorry, Cynthia, but if you
only the people I live with.
So if you play it back, I said stick within your household, your household. That's what I said. So that's what I believe in. Let's just get through this. I'm going to pass it over to Dr. Yaffe, but the message is clear: stay within your household when possible. And I say when possible. If you have one person lives by themselves and they have a small social group that they've been with, that they can't be left alone. But again, stick within your household. That's what I'm saying.
Thanks very much. The bottom line is COVID is spread person to person. So what you should do is think about every interaction you have with any other person and minimize interactions with people you don't know. And if you're not sure you can maintain the 6 foot or 2 meter distance, you should wear a mask. So that's the principle in every measure. So for Thanksgiving, we are recommending that you limit it this year to your household. And if your household is just one person, that person can join another household. So in my example, I have a son who lives alone. He'll be very embarrassed I'm mentioning this. And he will be joining us. But, that is to maintain some mental and social well-being for people. But yes, 10 is the max for indoors, but that doesn't mean you should go to 10. We are hoping people will stay with their household. And that is the best thing to do for this year for Thanksgiving.
Next question.
Your next question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. We wanted to ask you, yesterday you gave an impassioned response and again today during question period, about restaurant and bar owners who likely wouldn't survive a second shutdown. And you spoke about the bad actors flouting the rules and that it's not the entire sector. So if that's the case, why not implement a kind of secret shopper plan of action on these places and crack down with huge fines? Because when the pandemic hit, you set up that snitch line for price gougers, and that seemed to work. So why not implement a snitch line or fan out these secret shoppers to catch these bad actors so you don't have to shut down an entire sector?
Well, Elliott, first of all, I like the idea, and but in saying that, the vast majority of these restaurant owners, they're following the protocols, and by the way, we've enhanced the inspections. I've talked to the Minister of Labor. He's going to go after the very small group of bad actors per se, and I think the people that go to these restaurants can pick it off in a second, but the vast majority of them are just working their backs off. And as I said yesterday, these are people that have thrown everything they have and they own into these little family-run restaurants, and I just can't without seeing evidence, hardcore evidence, and people that sit on the table, the health table. Some are from Toronto. They're across the province, and they haven't been able to see the evidence. I just don't want to target just restaurants for the sake of targeting them. You know, I had a good conversation with Mayor Crombie, Mayor Brown, and Mayor Watson, and they're all in 100% agreement with what how we're moving forward. We have to protect these people. I'm glad to see the numbers in Toronto have gone down again to 200, and you can't put people out of work. Tens of thousands of people destroy their lives, just like bang, that quickly, just bang, they're done. I can't do that. I just can't. What we can do together, we can continue to implement guidelines, which we did, 6 to a table. Everyone has their contact information. We're closing the restaurants at last call at 11 o'clock. We've closed down the strip clubs. We've made sure the bars aren't open till 3 in the morning. But these restaurants are amazing people. This is their livelihood. And you go into any restaurant, you see all the guidelines they've put in place, from social distancing to hand sanitizers. Everyone's wearing a mask. These people are just struggling to stay alive. And I think all of us know a restaurant owner that is holding on by their fingernails. Do you know, I'm gonna go back. Does everyone remember when at the beginning of this pandemic, we had some naysayers, and I understand there's always going to be naysayers from other political parties saying, close down the construction industry, close them down, it's a disaster. Well, we ramped up the inspections. We went after the bad actors. We worked with the frontline labor unions and construction, which I absolutely love these folks. We worked with the companies that were building the towers and so on and so forth. And we saved 500,000 jobs on construction. And there was a handful of cases right across the country because we all worked together. Just imagine the disaster it would have been if we closed the construction trade, 500,000 people out of work, all the people that were waiting for their homes that couldn't get into their homes. And, you know, we made that call with consultation and collaboration with the construction unions, with local mayors, with the builders, Minister of Labor, Minister of Health, and 500,000 people continued to work, and they were building homes. Those same homes that people will be in very shortly. So that was the right call, and we just have to protect the small mom and pop restaurants. There's tens of thousands of people that work for these small businesses too, and I'm not about to see someone lose their livelihood and just destroy. When I say destroy their lives. They may own a home, they may lose their home. They may lose their condo. They may lose everything they have over one decision without seeing proper evidence, data-based evidence. That's all I'm asking for. And right now, I haven't seen it. So that's where we're at.
Follow-up?
And my follow-up is a question for you, Premier, as well as Minister Elliott, and it's regarding these private clinics that are charging for COVID tests. The Ministry of Health said yesterday in an emailed statement to our newsroom that it is not permitted and that Ontario Health has been directed to not supply swabs to any practice charging for tests. So on September 22nd, Premier, you were asked about these clinics charging for these tests and said it's a free market, but encourage people to go to provincial assessment centers. So has that viewpoint of it being a free market changed for you? And my question for Minister Elliott is, what if a practice gets their own swabs? Will they be permitted to stay open and still provide these tests for a fee, or will the province move in and shut these down?
Well, I'm going to pass this over to first the minister and then over to Matt Anderson on this one. Thank you.
Well, it's really important that Ontario Health not be providing swabs to private companies that are going to then charge hundreds of dollars for people to have a test when they can receive a test at no cost to themselves. And we are making those tests more accessible and available by having people make appointments and by increasing our testing and lab capabilities. So we really want to make sure that all of the swabs that Ontario Health receives are used for those public health purposes for the people of Ontario. And if they are able to obtain their own swabs, their own testing capability, fine. But I would rather focus our attention on the public capabilities and making sure that we can provide tests to all of the people of Ontario that need them. The other variable here is that some companies are providing testing for their employees at no cost to them, and the public companies are buying their own swabs and have their own arrangements for testing. That's fine, but no swabs that are meant for our public health campaigns should be used for those private purposes.
Great, thank you, and thank you for the question. The only things that I would add is that for sure, when we look at where our swabs are going, we want them to support the public infrastructure. One of the things also to bear in mind is for some folks, I understand that they may have trouble even with our online scheduling. We do have other options that can be arranged. We do have, in the East, we had a program with our paramedics where they would go to a home to do home swabbing if there was somebody who was not able to do it. And of course, in our vulnerable communities, we still do our mobile testing. So we still want to focus on those things to ensure that everybody gets access. The only other comment that I would add is that we also need to be careful on this notion of where is the test being processed. So when we think about someone charging and that it's a private enterprise, in some instances where it is well organized and fully with the support of the Ministry of Health and with Ontario Health, businesses are using other parts of our network to do the lab testing. That is not always the case. Some are charging and then they're sending the swabs to our labs to be tested, in which case now that is taking away from our public network. So we fully support the perspective of the Ministry of Health and doing everything we can to implement it. Thank you.
Next question.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Mike.
Hi, Premier Ford. We've seen this data that shows more than a positivity rate of more than 10% in certain neighborhoods in Toronto. That's an alarmingly high positivity rate. And these are neighborhoods in which there's a large number of people on low incomes and people of color. And at least one of the neighborhoods is right in your riding.
That's right.
Have you seen this data? And what should be done to address this issue?
Well, I did see the data probably about a couple hours ago. They showed me the data, and you're 100% correct. It's in the certain areas, and one being in my area. And that's where we have to focus on. We go out there, we put the mobile testing units up, we get more advertising within those communities, and if it's, no matter if it's the mainstream media or if it's the ethnic media, we're still pumping millions and millions of dollars to educate the people. But I'd like to hand that over to Dr. Yaffe, if I could. Thank you.
I haven't actually seen the data myself. I've read the article in the paper. that is very concerning. Those rates are high, and those are neighborhoods and areas that we already knew were at increased risk based on other data. So in terms of obviously mobile testing clinics, increasing access to testing, which is already occurring, but also we are going to continue to work with Toronto Public Health on how to reach those populations more proactively. And in addition to all the education, social marketing, and so on, and working with the ethnic media, I think the case follow-up there has to be prioritized. I know that Toronto Public Health has cut back on contact management, but perhaps in those areas, that's an area where it should be prioritized, as well as the long-term care facilities and other congregate settings, because we have to determine where these people are getting their infections. And also in terms of offering voluntary isolation facilities for cases if they feel that they are in a household where they cannot properly self-isolate, which may be the case in a multi-generational home where they may be quite crowded. So I think there are extra strategies that can be and are being implemented and need to be strengthened, and we'll continue to work with Toronto Public Health on those.
Follow-up?
And back to Premier Ford, back to this question about Thanksgiving. With respect, sir, I think your answers to the questions from two different reporters were slightly different. So could you clarify, how many people are you going to have over for Thanksgiving? Are you going to have anybody who does not live with you over for Thanksgiving dinner?
No, so can I confirm that when I call you back, or I'll call you back this afternoon? To be very frank, I don't get even a chance to even talk to my family. I'm here at my office till midnight, but I'll find out the arrangements. All I know is not going to be more than 10. It'll be within our household, and that's what I've been telling everyone. We have to just stay in within our households. It's about as clear as anything. As I said the other day, just tighten it up. Stay within your households. We can get through this. We can get through this Thanksgiving. I know it might be tough on some people, but we will get through this.
Okay, this will be last question.
Your final question comes from Ryan Tamilty with National Post. Please go ahead.
Yeah, Premier, you've talked about this a little bit before, but I understand that getting reagent for the Roche testing machines has been a particular challenge for the province. Mm-hmm. I understand the federal government has a fair supply of more generic reagent. I'm wondering if you've looked at using that, if you have any concerns about having the proprietary system with Roche?
Yeah. Before I hand it to Matt Anderson, I did have a conversation, probably numerous conversations with Ronnie Miller, the CEO of Roche. I know the Deputy Prime Minister had reached out to the overall CEO worldwide in Germany. There's a worldwide shortage of reagent, and I'm going to pass it over to Matt because he can explain it a lot better than I can.
Thank you. Thank you for the question, and thank you, Premier. The only things I would add is directly to your question, we call it reagent. That's kind of short form. In fact, what it is a whole kit. It is proprietary to these particular machines. These machines are world-class machines. They're excellent. The challenge, of course, is that everybody knows that they're world-class machines, hence why we are now in a global shortage for the entire kit, not just the reagent. So we can't actually substitute it. I can confirm the Premier has gotten me on the call with the head of Roche, I believe on a Saturday. I believe again on a Sunday. He absolutely is seized of this. I'm doing everything we can to see if we can get more supply into Canada and into Ontario. And that's sort of where we're at. We're not able to sort of replace this proprietary kit. Thank you.
Follow-up?
Yeah, I mean, I'm wondering too, though, are you considering going with other testing machines that aren't Roche, so that you could use some of this generic reagent that the federal government seems to have in ample supply?
Great. Thank you very much for the question. So short answer is yes. In fact, we've been looking to diversify the equipment that is on our network. We have a little over 120 different analyzers and machines on our network currently. The challenge is it's not quite so easy to say, well, we're just going to move away from these. They are very high process machines, difficult to meet with other providers. However, we are working with a number of wonderful providers who are looking at getting us some more equipment. In fact, we're close to bringing on some more equipment from a different vendor, probably in the next 4 weeks or so, 4 to 6 weeks, which would bring with it the capabilities in around 25,000 additional tests per day. So we do look at diversifying. I would also add, for any of you who have ever worked with a computer system before, as you've heard, all of our team members in the labs are working 24/7 to bring this thing to increase capacity and to keep the flow. Difficult at that time to start to swap out pieces of equipment. Even adding pieces of equipment, you recognize that training would be involved in other things. So while we're absolutely committed to doing that, committed to diversification, and committed to bring on more capacity, there are some just practical challenges to bringing that on side that we're working through today. Thank you.
Thank you, everyone.
Thanks, everyone.